Yesterday, we reached a sad milestone. We recorded over 200,000 COVID-related deaths in the U.S. I want to go back to the beginning to look at where we started and where we are now. I think it is important for the American people to understand and remember what the context was when this outbreak began, where we are now, and that the president called on the American people to come together by shutting down the country for 45 days to avoid the catastrophic models calling for millions of deaths by August 1st. On March 16th, President Trump issued guidelines for governors calling for a partial shutdown of 15 days to slow the spread. By March 29th, it was clear the president again followed the advice of the task force and called for an additional 30 days of shutdown to slow the spread of COVID-19. And Dr. Fauci, I have several questions for you, and a yes or no is fine unless you want to elaborate further. And then one final question for Dr. Hahn. During those critical days in March, was it your recommendation and that of the task force for President Trump to issue the guidelines to shut the country down for 45 days?
Yes, I wouldn't use the word shut the country down. It was to implement separation, avoiding contact, all the kinds of things we did in the recommendations. So the short answer to your question is yes.
Thank you. Let's look at the chart over here. This was used by Dr. Birx at the task force briefing on March 31st. We can all see what Dr. Birx called the giant blue mountain that predicted over 2 million deaths without mitigation efforts, and the stippled foothill that shows a range of 100 to 240,000 deaths if we took the drastic actions to put the mitigation into effect, which did require some shutting down of the country. Did you and Dr. Birx explain at a March 31st briefing that initial projections from the health experts showed that if we did not act, the death tolls by August 1st could exceed a couple million?
Yes, that's what we presented, based on a model, sir. It's a model.
Sure. And was the goal of the national mitigation effort to bring the projected death tolls down from over 2 million to the range of 100 to 140,000?
Yes, with an exception, because as I mentioned at a press conference associated with that, I said the model would say it would go down, but I don't think we should be accepting that we could likely do much better. If I could just have 20 seconds more, I'll explain it. Because if we had done the kinds of things uniformly and consistently throughout the country of the recommendations of the gateway, phase 1, phase 2, phase 3, what would have happened is that we would have had less than that. And we know that some states did a good job, some states did not so good a job. Some states tried to do a good job, but people didn't listen. We saw pictures of people congregating at bars with no masks. So even though the model said that that likely would be the number of deaths, I and my colleagues always said we should strive very hard to not reach that number if we did the public health measures that we were talking about, masks, physical separation, et cetera.
So outside of that qualification, which I think it's admirable to try to always best what you think might be the case, do you think the actions of the American people and the actions of President Trump and the task force at least hit where you were hoping, notwithstanding the qualification that you made?
Yeah, what we did show, and we know the data, and that's very important because it helps us to look ahead, that the kinds of things that were put into effect, the mitigation, going from control as well as mitigation, we believe have saved a lot of lives.
Would you agree that the task force and the president took the outbreak very seriously from the beginning, taking unprecedented action, saving millions of American lives as a result?
Yes, I mean, obviously, I think one of the first things that we had said and discussed before was the shutting off of travel, for example, from China, and then second after that, we did it at a time, for example, when we were getting cases from Europe, which actually seeded the northeastern part of our country, particularly the New York metropolitan area.
I think the importance of that is understated in terms of those early decisions, what impact they did have. As we can see from this chart poster, a quick Google search will reveal that the President and the task force told the American people on March 31st, millions could die if we did not follow the White House guidelines. If we did everything optimally, then we would be where we are today. If we want to ask the American people to continue to take the virus seriously and keep making sacrifices in their daily lives until we have a vaccine, then do you think the media, politicians, and scientists like you need to do a better job reminding the American people about the Blue Mountain warning of millions dead and how their collective actions will continue to save lives?
Yes, Senator. In fact, virtually every time I am in the public and are given the opportunity to talk about this, I continue to stress the 4 or 5 things that if we all did it and we did it consistently, we would not only prevent the surges that we've seen, but we would also get those surges down, as we're seeing in different parts of the country now where cases are starting to come down. So some of the areas of the country that are doing it well are seeing a good control, and others are not. I think we need uniformity throughout the country of a consistent adherence to the public health practices that we talk about.
Thank you, Senator Braun. Senator Jones.